beauty, yeah. And the melody, your eyes so true. I cry. I can't even lie. I cry. I try to hold back the tears. They slide right out my eyes. Trying to hold back tears, they keep falling. If it wasn't for sickle cell, we'd be ballin'. Memories, so many memories. From here on out, they gon' remember me. It's that Midwest soldier over these Haitian beats. Your best taste, catering flavors over these beats. Tears slide out my eyes onto my cheeks. Eyes all puffy, ain't got real sleep in weeks. And soldiers keep dying, condolences, rest in peace. I'ma keep stepping for soldiers like chasing geek. Knee deep in this game and I got mud on my cleats. Stains on my jersey, bitch, I'm worthy like James. A legend like LeBron, giving game to my mom's about her sickle cell trait. Pops died on me when I moved out to the A. Covington, middle tens in my pocket with pills approved by the government. I cry. I can't even lie. I cry. I try to hold back the tears. They slide right out my eyes. Reminiscing on how much we struggle brings tears to my eyes. Just thinking on how much we suffer brings tears to my eyes. If I died today, nobody notice it. Sickle cell soldier shit. Damn. When we pass away, nobody notice. Sickle cell soldiers. Misrepresentation, I won't stand for that. Gotta honor the soldiers whenever I get on the track. Cause I know that they listening and they gon' run it back. Trying to hold tears back like soldiers speaking real facts. Know that they quit to judge, but they ain't quick to heal us up. They think it's for the drugs, they see us 3 times a month. I got 3 different hustles, I can't be admitted, bruh. Stress that sickle cell just does what it wants and I cry.
All right, all right. Thank y'all so much for joining today. On screen before you, I am Simona Wright James with Marijuana Matters. Thank you so much. Again, we wanted to share that quick video with you just to really set the tone for this conversation. That's what it's supposed to feel like. Marijuana Matters, we pride ourselves on being a social enterprise that really exists in the hub, right? The hub of industry, government, and community to really make sure that we're having conversations about what it looks like when social equity is applied in practice and in policy. So this conversation around sickle cell and cannabis is very near and dear to our hearts because it allows us to have this room, take this time to really talk about what it's like for individuals who may have the trait or the full sickle cell and how cannabis may be used to help in their treatment. And again, just to have a full roundness of this conversation, the video we shared just a second ago is from a brother who will be joining us shortly, Brother Prophet, AR the Prophet to be exact, who's someone who is who has sickle cell. He's a survivor, and he's continuously being an advocate for cannabis in relationship to treating sickle cell. And we are joined today with 2 beautiful folks, and you all are ironically on my screen, sitting to my left and to my right today, who will be facilitating this conversation for us. Rebecca, would you please introduce yourselves to the folks?
Hey, my name is Rebecca Abraham, and I am a registered nurse. And I worked in academic medicine for a long time, about 15 years. Most of my career was spent in critical care, but I did spend some time in case management, heart failure, floor nursing, and then later policy, and now cannabis. So I started a telehealth startup that helps people use botanical medicine correctly to alleviate symptoms. So sickle cell disease and the chronic pain cascade certainly fits perfectly into what we do, just because I saw people just weren't being served by healthcare in general as it was. So this is very much a supplement, and cannabis has a huge part in helping control symptoms, amongst other things. So that's me.
Awesome. Thank you so much for again facilitating this conversation. Dr. Ryan, please introduce yourself. Uh-oh, I think your computer might be muted.
Or the sound didn't connect.
Let's see. Let's make sure on our end. Uh-oh, let's see. No, maybe grab headphones, maybe do the trick, or ensure that your sound is being shared through Zoom. And I think I see Rebecca, she's doing some fast fingers, also probably sending some notes to you on in terms of how to get your sound up. But thank you all again for joining. If you would like to share, we have this opportunity to obviously be in community together, right? So if you want to use the chat down below, feel free to do that. That's one of the advantages of Zoom, I feel like, is that we can have like this rounded conversation that is inclusive of everyone. So just in the interim, feel free, if you would like to share who you are in the chat or go off mute, you are more than welcome to do that at this time.
I can start his introduction while he fixes his sound. So,
okay, awesome.
Ryan and I met like a long time, 15 years ago when he was in residency and I was a new nurse. And so he was always a really amazing doctor. And when I began in cannabis, he was kind of one of the skeptical doctors that we hear about. He was like, well, it seems fine. He used to post studies like on social media about, benefits we were seeing. I'm just giving him his brief intro. And then he started seeing our work on the nurse side. And I started sharing, just how patients were doing and how it was doing, them a service. And then he came along to join us to do research. So, and, amongst other things. So.
Awesome. Oh, that is super exciting. Again, I see your audio is loading, Dr. Ryan, so don't worry. I'm sure we'll hear from you soon. At this time, if anyone would like to take the mic, they can to introduce themselves.
Hello, my name is Candelaria Pierce, and I'm a nurse practitioner in Georgia that's looking into getting into more cannabis-friendly treatments for my patients. So I'm highly interested to see how cannabis and sickle cell go hand in hand, especially treating that sickle cell pain. So thank you for having me, and thank you for offering this class. I hope to gain a lot of information, and I'm excited.
Oh, that is wonderful. Thank you so much for joining and from Georgia. I love it. I love it. And just so you know, I'm joining in from DC, and Rebecca, you're tuning in from Illinois, right?
Chicago.
Chicago. So we have some diversity in location. Welcome. Thank you for joining. Anyone else want to share? Intro, who they are, where they're from. Again, no pressure. Just want to offer up one more time before we get started.
Can you folks hear me now? Okay, good. I don't know what was going on with the computer audio. I just dialed in via old-fashioned phone, so sometimes older technology works. So my name is Ryan Buck. I'm a hospital medicine physician at Northwestern. Yes, I started working with Rebecca a decade or more ago, which seems impossible because that would make us old. But obviously I deal with we see a lot of folks with sickle cell on the inpatient side of medicine, and then several years ago I joined Rebecca, and I work as both the research director for acute on chronic.
I love it. Thank you so much, Dr. Ryan, for joining us. We really appreciate it. We understand your schedule, both of your schedules, I'm sure, are super busy. So taking the time out to just share and have conversation around cannabis and sickle cell is, we're appreciative. Thank you. Yeah, Rebecca, feel free to take it over from here. I'll be back. I'm going to just make sure everything's posted on our socials. And if folks have questions, please do not be shy along the way of this conversation to use the chat. There is no stupid question. That's why we are joining in community today, is just to have a conversation and share what we know. So please use the chat.
Yeah, hi. So I did this talk with Marijuana Matters last year, and it was one of my favorite panels of the year because sickle cell disease is not something that we talk about enough. And that is one of the problems in healthcare that inspired me to start my own telehealth company. So one of the things that always bothered healthcare and kind of gave me the drive to kind of go above and beyond floor nursing, critical care nursing, was I didn't like how access to treatment for things like sickle cell was difficult for a lot of people. It's a hard chronic illness to manage, particularly because you are having a disease that affects children, and those children grow into adults. There is also a lot of implicit bias in healthcare. And one of the things that kind of came to me when we were discussing this in the pre-panel last year that I never really thought about a lot is I grew up and went to nursing school on the south side of Chicago, which is a pretty diverse community, you know. So there's a lot of sickle cell disease where I grew up. And I went to nursing school on the south side of Chicago, and we never really learned that much about sickle cell, which is kind of astounding if you think about it. The education I got about sickle cell was through my training at work as a nurse through other nurses. And the biggest problem I identified is because nurses aren't traditionally trained on sickle cell, is that there was a lot of stigma in treatment. In the middle of the opioid crisis, then there was added stigma related to opioids. And so I saw that these patients were getting a disservice. And luckily, thanks to a few, really passionate other healthcare workers, we were able to kind of crack through some nurses. I kind of, learned very early on, I think in clinical, that this pain is very real, it's intense. Having a sickle cell crisis is incredibly painful with a lot of symptoms. So that's one of the things that makes me passionate to talk about this in a public forum, because I do feel like even beyond cannabis, which I think could be potentially, in the future, something really, really a useful tool once we see some laws changing and more research. I do like doing these talks to just kind of bring attention to how healthcare workers can do better now today in doing better for these patients, helping them with their symptoms. So feel free to add any questions, comments. There's kind of, all comments and all questions are really valid. So, and I love that there's a nurse practitioner here too. So, Ryan, do you want to start talking about the potentials of how cannabis could potentially help with symptom control in the future, and kind of how essentially the opioids aren't actually as effective, and we probably should be looking for new ways to control symptoms beyond kind of classical thinking.
So, I know, taking care of folks with sickle cell disease do not do well. There's a whole host of reasons. Racism and bias in medicine, I'm a huge component of it. And in general, though, even setting that important aside, we are just
your volume went out again.
Hear me now?
Got you. Now you're very
Okay.
loud.
Okay, we'll try and project. So we are just bad in general at treating these kind of chronic illnesses and chronic. And pain is something that just in general that the healthcare system is not good about. If somebody comes in with, they break their arm, acute pain, things like that, that's something that we can manage. Who have got chronic, either ongoing every day or recurrent episodes of pain, it's just not something that we are very good at. And it's something that, unfortunately, I see time and time again, it's very easy for healthcare providers to get burnt out and jaded and not have the empathy and caring and energy that is really needed to kind of help these patients. Obviously, that's not everybody. There's some great anybody with sickle cell can tell. Anybody with sickle cell will be able to say that they've had more than one bad experience with folks in the health, not believing them, not wanting to help them, and figure out a system. Having said that, the pain associated with sickle cell is extremely difficult to treat. Able to attest. And opiates, they are good for some things. They are pretty good for some kind of acute pain and things, and they definitely have a role in helping folks with sickle cell disease. But there's a lot of changes that happen to the body when they are exposed to opiates. At high doses over time, effectiveness and rotate to different opiates. You get to doses where in order to kind of continue achieving pain control with the opiates, you get a lot of other unwanted side effects, not just, what you might think of like the sleepiness and sedation, but you can get into really significant like myoclonic jerks where kind of the muscles start to kind of like twitch and spasm and a lot of other uncomfortable things. And then some folks, not everybody, but some folks can develop this kind of opiate hyperanalgesia, so kind of overactive analgesia, kind of where over time the body's pain receptors are so used to seeing these opiates that they kind of rewire and rethink themselves, and that without the opiates, just without any kind of pain input, they are still telling the body we're in a ton of pain. They've gotten so used to those high doses of opiates. And that creates a very, very vicious cycle where people continue to need opiates in order to kind of just finding alternatives to pain control that are good, that'll help these people, I think is of vital importance. And we do use adjunctive things. There's Tylenol, there's NSAIDs, ibuprofen, Aleve, Toradol, stronger ones. Gabapentin is used. We do have things that we use. I mean, I can see. I definitely. The effectiveness of a lot are moderate at best, and a lot of, especially for people with bad symptoms, is really the cornerstone. I think that we're really excited about cannabis as this new tool that could be used. I mean, is at least in terms of helping as an adjunctive treatment and reduce the amount of opiates and help reduce the amount of times where crises get so bad that people need to come into the hospital and things. And I think the science behind it, I think, is good, that there's a variety of mechanisms that can help. THC itself, interacts with the nerves in the central nervous system and can kind of help down-regulate those kind of like pain sensors. And so when somebody is getting this kind of constant input from their body about like, we're in pain, THC kind of helps down-regulate those pain sensations as they're going. In other parts of cannabis, things like CBD, which I think everybody has probably heard of, it's in a corner grocery store and things like that, although the products there are not always the most legitimate. But other cannabinoids too, like CBG and some others. In addition to kind of helping modulate pain, they actually have some direct anti-inflammatory properties. They work on the same systems in the body that NSAIDs like ibuprofen, Advil, Aleve, naproxen, all of those do, only without some of the bad side effects that can come with those, like kidney failure, risk of GI bleeding, and things like that. So some of those other adjunctive cannabinoids can actually reduce the inflammatory process that goes on and is a part of those kind of sickle crises and as a part of pain in general. And so I think that from some of the evidence and some of the experience that we have, I think people can really get some really significant relief by incorporating cannabis and those products into their treatment program.
Yeah, and there is a real importance to and I want to be clear, like we're not saying that cannabis can cure anything, but what we have seen so far is cannabis does help relieve symptoms. And so what is sometimes key to improving patients' quality of life, in what from our internal data we could see thus far, particularly with folks with chronic pain, is keeping folks out of the hospital and out of crisis can truly help. We see this actually a lot in pediatric patients with chronic pain, right? And I think this is particularly true for kids with sickle cell disease, right? Social emotional aspects of childhood and development are so important. And something that at least in adult nursing and medicine we don't really talk about is when we see very anxious adults with sickle cell disease and they're hospitalized, and they're very anxious, and sometimes they're upset, rightfully so, is because they've spent their childhood in the hospital, they've missed school, there's a lot of like social emotional aspects, particularly as a teen, sometimes they're missing out on things, missing being with their friends. Teenagers don't particularly love visiting their friends in the hospital, if they can even get in or have access, right? So keeping kids with sickle cell at home and treating them and their symptoms as long as we can at home without a crisis is really important for social emotional well-being. And that is something that I think there's a future likely for cannabis. And what's interesting is your tolerance to cannabis and how it affects you. There's so many things that affect it. It's kind of how our company ended up existing, right? It's not really as easy as just like finding a cannabis product or smoking it and just having it work. One of the things that we try to do is we try to match the dosing to the patient. So children have less cannabis receptors. Older adults have less cannabis receptors. They're kind of dulled. And what's really interesting that we've seen from our internal data is people with a lot of symptoms, like a lot of pain, a lot of anxiety, a lot of something, spasticity. When we add THC and other cannabinoids in particular, but THC, we actually don't see the euphoria if people have a lot of pain. We actually see pain decreased, but we don't see that high. So I'm going to bring this into the next conversation, which is like, how do we get more healthcare workers passionate about this, interested, doing studies so we could kind of prove these things truly, is I think when we tell people like, no, there's the euphoria, we're Americans, so anything that feels good, we kind of consider bad for some reason because of our roots as a puritanical country. But I think kind of talking about like, no, like this is not just euphoria. This is not just getting altered. Like this has real potential and pain treatment qualities, I think is something that's going to be important to share with the broader medical community. And then of course, one of my favorite phrases is in healthcare, we spend 90% of our time talking about 3% of the plant. So THC is absolutely a fantastic tool for pain control. Also, I kind of have like a thought question that kind of came to me. So one thing that's interesting about THC is it does something called bronchodilation, which means it kind of opens up your airways, right? So prior, in the early 1900s, THC and cannabis was actually smoked to help with asthma. Who would have guessed, or breathing problems? Is something I wonder, and maybe Ryan, the kind of pathology is, so with sickle cell, there's a problem with oxygen because of how the blood cell is shaped. The red blood cell isn't adequately carrying oxygen. So a question I have is if THC bronchodilates, could that help relieve any air hunger or oxygenation? Because I know when these folks are in crisis, we put them on oxygen. Is there potentially like a relationship there? Thanks everyone. I'm asking this in real time because this is the kind of the first time I've ever thought about this. So.
I mean, obviously we haven't studied it yet, but it may help. I mean, and you know, part of the reason why the oxygen therapy helps is that getting more oxygen into those sickled cells can help, you know, alleviate like how severe the crisis is, and sort of can help anything that kind of opens up the airways and kind of gets more air exchange and more oxygen in. I think.
Yeah, I kind of just wondered, like, is this something that's like worthy of, you know, being studied, or, you know, again, symptom relief? And like, again, like I would never ever say like, you know, don't use oxygen, like just never. But, you know, again, like if there is symptom control there, like is that something that perhaps we should study in the future? So yeah, thanks for it just kind of came to me in the moment.
And obviously, you know, the oxygen therapy, you know, is something that we often do in the hospital. I think the goal for, I think, anybody with sickle cell to spend as little amount of time in the hospital as they can. Anything that we can do that can help, you know, manage kind of the more mild to moderate symptoms at home, that kind of saves folks, you know, trips into the hospital. I think anything.
Yeah. The other way that cannabis can be a very, I feel like, useful tool is what we see is, so there are actually a lot of pharmaceutical interactions and supplement interactions with cannabis. And again, not actually with THC, but particularly more with CBD. We see this quite a bit. So, but one thing we've noticed is sometimes those drug interactions, and again, this needs to be studied so much more because we're just like, I know everybody who's been looking at cannabis for a bit, if you're watching this from the cannabis industry, everybody kind of compares being in the cannabis industry to dog years. Where was I going? Oh, I know, with this train of thought. So we're just very much in the infancy of research, and there's quite a bit more cannabis research than most people assume. There's somewhere, I think, about just overall 25,000 to 30,000 studies now. In particular, many of them international, of course. So we don't truly know about these drug interactions as much as we should. We're kind of making assumptions from other supplements and plants that work on this same system where cannabis is metabolized. But one of the things we are inferring and we think is sometimes when cannabis is processed in the liver, sometimes we wonder if there is a synergistic effect with other medications. So something that we've seen a little bit in our work here with chronic pain and some sickle cell is when we combine cannabis and a patient is taking opioids, is we'll oftentimes see, and there's some of this in the literature too, we'll sometimes see that the cannabis actually allows them to use less opioids. And should we do more research and find that to 100% be true, what would really be great is that would be a way to the entire thing Ryan talked about how, you know, the dysregulation and how the body won't even see the kind of the pain medicine anymore. It could be a way to kind of keep other medication dosing low. So the patient has a little bit of a longer runway to burn out those opioid receptors. So that is another really great potential there as well. And I know I did say like using for, you know, medical cannabis for pediatric patients. What's fascinating is when we do have pediatric patients using cannabis, they aren't getting, again, that euphoria is missing. They're not getting altered. It actually, you know, sometimes we see a decrease in symptom burden, but not that euphoria. And then what's funny is you could actually like I've talked to some parents who've tried their child's, you know, dosing. And they're like, oh, wow, this is intense. Does my child feel this? No, your receptors are much more robust. And I just also want to clarify. So when we have worked with pediatric patients, and one of the other cannabis clinicians have as well, we always discuss this with their pediatric team. So something I like to talk about, particularly when we talk about something like sickle cell, and we're talking about, particularly folks in Black and Brown communities utilizing cannabis, I want to be forthright that think of personal safety first. There is a lot of stigma in cannabis, and depending on where you live, the laws are not as friendly. And then also, we also know there's a lot of stigma and bias in healthcare too. So I always recommend when I do these talks, like personal safety first. If you don't feel like you have a healthcare provider that's going to be open to this, if you feel like there's even a chance of being stigmatized, like definitely find a safe person or a safe clinician to have that conversation with. Advocates are helpful, or at least somebody who kind of knows the healthcare system a little bit. But we always have this conversation with the pediatrician before doing anything. So it is a really robust conversation before it gets to cannabis. And one of the things that's a little frustrating of doing this work for so many years is the more I've been working with cannabis and reading and studying, the more kind of research that's been done is, if you look at the side effects of cannabis and you put it just back to back with other medicines, even Motrin, or sorry, ibuprofen. Sorry, no real names. But any of the NSAIDs, the safety profile is a bit better for cannabis. We really don't know of truly any long-term, deficits. The data we have is not great. Anything where you see cognitive deficits popping up, that research, we don't really know where that cannabis came from. It wasn't really being used for medicine. So my hope for the future is it becomes a first-line treatment option for folks with chronic pain, and not a last line. And right now, when we have that conversation with pediatricians, pediatric pain specialists, it is the last resort when people are like truly just not having a great quality of life. So that's something I hope to see turn around. But I want to empathize that I know that this could really be a scary conversation for anybody with their doctor, depending on the state, but like very much particularly in Black and Brown communities, where there's not only been the war on drugs and devastating, horrible effects very unjustly to those communities in the criminal justice system, but then also kind of the double hit of like, there's also a lot of implicit bias and stigma in healthcare. And then like the extra layer of like, the uneducated clinician, nurse, doctor on how truly painful sickle cell can be for patients, and kind of a combination of, ignorance and sometimes just a lack of empathy. Unfortunately, some people get kind of burnt out faster than others, and it's the conditions in the systems and are sometimes rough, and it kind of even takes your most bright-eyed and bushy-tailed healthcare worker and just makes them very kind of grumpy. That's not great for patients. And so I could go into a whole thing about this, and please feel free to ask any questions. One thing that I do, when I hope somebody hears this from YouTube, TikTok, wherever this may go viral, is so how do we start fixing these? Like, wow, Rebecca, like you just said cannabis could be great, and then you just named like 700 reasons why I maybe should not talk to my doctor ever about this or try it, because now, like, yeah, there's a lot of bad. So how do we, like, what's an action item? Like, how do we change this? One thing I think everybody can push for: better education in nursing and medical school for sickle cell disease, sickle cell trait, particularly in areas where you will see this disease most often. Like where I went to nursing school, I should have had more training on sickle cell disease. Another thing that's really important is who are practicing medicine and who are our nurses. Getting more folks from Black and Brown communities, more Indigenous communities into healthcare, I think is really, really important, because that's how we're going to get better treatment for folks, how we're going to have more empathy, we're going to broaden our view of how we're treating people and what we're doing. So I always like to say that because I really want to encourage anybody who's thinking about going into healthcare, like, please do it. Like, really, especially if you're from these communities, if you have no idea, like, or you actually probably have a greater idea than even I do of how much you can make a difference for patients too. I mean, even the research says this is true, the more diverse healthcare becomes, the better our outcomes are. So that's something. And Ryan, feel free to add anything. Sorry, this is why I love this panel last year. It's just something I'm really passionate about, is access to healthcare and just better treatment of patients overall. And that's what I like about cannabis, is it gives us that opportunity to have perhaps an affordable, safe treatment option for folks, to improve quality of life, but then also like room for anybody who's interested in getting into healthcare to see, like, we're not all squares. We're like, interested in improving the way things are done and trying new things, not having this like myopic, like very quick care, like in out system that we have, and treating the whole person and, accounting for the unique differences in all of us.
Anybody else has any other questions or anything like that? Yeah, we're in a tough spot. I think that, with the opiate crisis as it came, message that a lot of docs internalized was, I need to prescribe less opiates. And unfortunately, not everybody, but unfortunately, a lot of people just, what they decided to do is like, all right, anybody that's got an opiate, I'm going to give them less. Well, okay, but how are you going to treat my pain? And then they're kind of like, I don't know. That's not a good plan. And so, I get so frustrated. And it's true, like, opiates are there's a lot of issues with them. I mean, they are definitely safety issues. So, yeah, so I think that, like, just getting that breakthrough, like the doc's like, yeah, we'd love to help you find less opiates too, and this is a tool for that. And study after study shows that, like, patients who start on cannabis regimens, they fill less opiate prescriptions because, and in my opinion, safer and so yeah, so I hoping that the more and more of that breaks through. That
Ryan, your sound went away again. There is a question. So when it comes to cannabis use for adults with sickle cell, is there a particular form of THC that's better, smoking versus consuming through food? So it truly depends on the person and everything going on with them. One of the parts of our methodology that's really interesting, and why I very intentionally brought nursing methodology to cannabis, is it really depends. So there's no one size fits all anything when you utilize cannabis as a supplement for any kind of symptom control. Some things we look at. So we look at other medications or supplements somebody is on. We try to be really careful because we don't truly know how much interaction there is, or when, or how. So just to be on the safe side, we always recommend that people use cannabis a little far away, at least 30 minutes to an hour, away from other prescription medications, because there's interaction. So we just want to be sure that we're not going to tip anything over. It really depends. So would I have a 25-year-old heavily smoke daily cannabis for symptom control? I don't know, because while the data suggests that smoking cannabis is essentially not as, you do not have the same risks when you smoke cannabis as you do when you smoke nicotine. So that's good news. But, anytime you kind of put anything that's not room, air, oxygen into your body or lungs, there's always a risk of making it a carcinogen. Somebody who's 25, I might say smoking for acute pain because it works fast might be a really good methodology. But we don't want to tap into that heavily more every day, just because hopefully you have a long life ahead of you, and we don't want to increase your risk of any bronchitis or cancer. That being said, if somebody's in their, and I say this a lot in talks, if somebody's in their 70s, 80s, with any kind of chronic pain, or even 50s, 60s, let's say they have a poor quality of life, 50s, 60s, and they're really acutely sick from their chronic illness, right? That's a case where I look at the person and I say, look, like, we need you to be out of the hospital. We need you to eat. Maybe we should vaporize or smoke. It's a very different situation. Depending on how many other supplements or pharmaceuticals somebody on, we may not want to have edibles because it will pass through the liver twice, making a kind of higher chance of drug interactions. So truly, it depends. One of the things that is most important is having a diverse cannabinoid profile. So I said THC is kind of 3% of the conversation. We have all these other things. So CBG, CBD, these are cannabinoids that I feel like enhance part of what THC does. And so we see the best effect happen when we use multiple cannabinoids. So think of cannabis, like all cannabis, as a if you were thinking of it as musical instruments. If you were just to use THC, you have a beautiful piano song and it sounds great on piano. But think about if you add CBD and CBG, then you would have a symphony, and the sound is still beautiful, but it's even more beautiful and more effective. So that's something we see. So we always recommend diversifying, not just THC, utilizing other things as a base to kind of help everything work better. And why is this? You want to really dive into the science. It's either the entourage effect on the neuron level, or it could be our enzymes in our liver. We don't know yet why it's enhanced and better effect with less side effects. It's just what we see and have to learn more about.
Then I say, just to add to that, I think it's all great advice. I say, depending upon the nature of the pain and how you're trying to manage it, I think important considerations. That like vaping and smoking, it's a pretty quick onset of action. So if somebody is in 10 out of 10 pain right now, something like that, where you'll start to, feel the effects and get the relief immediately, might be something that you, at least traditional edibles like gummies and things like that can have a much more variable onset of action. Just your body's physiology can affect it, what you've eaten recently can affect it. So it could be like 30 minutes, could be an hour and a half, 2 hours. So if you're in 10 out of 10 pain right now, taking a gummy, you might be still in 10 out of 10 pain for a solid, hour and a half. Now sometimes the edibles, they can last longer than some of the. So I think oftentimes, and I think we've seen this with our patients, that usually there's not just one treatment or things like that, but kind of a multimodal kind of approach where there's some, kind of edibles or tinctures that people might even take daily in order to kind of get some kind of, for people that have chronic or daily pain, sustained relief, and then have something else that works more quickly when they have that kind of acute break. Can be smoking or vaping. There are some other edible formulations. There can be sprays, drops that you put under the tongue and things like that they do get in more quickly than, say, like a gummy that you swallow and has to go through the record metabolism before you get the effect. So there are ways to get that fast relief that aren't necessarily smoking or vaping, but a lot of considerations that go in when you might use one versus.
And social considerations too. Anybody with a housing voucher, you can't smoke on premises or vape. And we obviously don't want anybody to lose their housing. So that's, I don't think you're actually supposed to use any cannabis, but that, you know, if you're in any kind of living situation, apartment, condo, anything, you don't want to risk losing your housing. And then the other thing is, particularly with older adolescents, college, right? Dorms have a policy where you can't, many colleges, even in medical only states, do allow for medical cannabis for college students. So that's another case where the social aspects and the lifestyle is something else we have to consider, is like, where is this person living? You know, we obviously want to keep them out of any sort of trouble. Nobody wants that. Even like minor trouble would be annoying. So that's another case where we recommend like a lockbox and using edibles in that case, or tinctures. Tinctures are great too. They work a little bit faster. They're kind of the in between utilizing smoking or vaporizing and edibles. They work in about 15 minutes to an hour. And you get a little bit better dosing accuracy on them if you were like at a very specific dose. There is a study that shows like even just a little bit more of THC cannabis by like a milligram or two could really change the side effects of what you're feeling. So for some people, those tinctures can work. So that's another reason, like depending on living situations. We do work in some facilities. Not that I've necessarily seen a lot of folks with sickle cell disease living in facilities. But if somebody were to go to, you know, a subacute rehab facility, some facilities are becoming more open to cannabis. It actually depends on the director of nursing. So know that if you are a person who ends up in, you know, a subacute nursing facility, acute nursing facility, something after the hospital, that there is a chance, depending on the administrators, that you can use cannabis in that facility. You just have to ask the director of nursing. And so that's another case where, like, depending on, you know, what's going on with their staffing, is it a family member giving it, what are their rules, when we would kind of click into, you know, deciding on some of these other routes of administration. There's also patches, which I think are great. Another not an edible, but not, you know, not smoking. You put it on your wrist. It provides quite a bit of pain relief. It goes right to the bloodstream. So those are really like a good option too. So yeah, it's so interesting where in traditional medicine and pharmacology and, you know, the kind of model we have now, there is a lot of like one size fits most kind of standardized dosing for a variety of things, right? Anything we've ever learned in pharmacology, we know that there's like, for this medicine, it's 3 milligrams, 5 milligrams, or 10 milligrams. That's kind of it. Like, those are your choices, right? That doesn't work. You go to here. There's very specific algorithms, right? Part of the work I'm trying to do and we're trying to do is there is no really specific algorithm that we could truly find that exists in cannabis, not yet. We're starting to get more clinical clues. We truly have to take a deep dive into the patient, kind of learn everything about them, and then make a plan to go forward with them. So it's very, very different. And sometimes we, you know, what we figured out, so this is the most important thing. This is what I want to close with. So if you are choosing to use medical cannabis, where can you find cannabis clinicians like us? So we are in all 50 states, but we are not alone. We do the work we do because we can't do it inside of a hospital. So that's why we kind of ended up as a business. We would have loved to do this work inside a hospital, but because of the federal restriction, we can't. So we may do with what we have. So you have us. But if you use other great resources to find a cannabis clinician near you, is the Society of Cannabis Clinicians has a list of cannabis clinicians. There are cannabis nurses of color. They're fantastic. There is the Association of Cannabis Nurses, and I'm missing somebody somewhere. And I know Marijuana Matters is based in the DC area. And so we have a great relationship with GW Integrative Medicine, Dr. Dr. Kogan is amazing. So there are some of us, there are some very specific cannabis doctors and nurses, not many, but there's some of us. And I recommend, you know, if you want to pursue this avenue, to definitely use these folks, use these resources. But no, biggest takeaway is cannabis as a supplement and tool to relieve symptoms and improve quality of life does take time, actually much longer than most things in pharmaceuticals. And how much time for who and when, it really depends. I've seen people start feeling better, you know, within days of trying one thing. And then I've seen people work with us for 6 months, feel a little bit better, and then all of a sudden they wake up and they're like, wait a minute, symptoms are much better. And it's like 6 months in, nothing has changed. So sometimes we think there's an absorption, that there's restarting your endocannabinoid system. That's a bigger conversation, but overall, no, if you choose to start cannabis, no matter how you choose to start it, that it does sometimes take some time because it's absorbed in our fat cells. And there's something very strange about the CB1 and CB2 receptors. So give it time. If you start cannabis and it doesn't work right away, you feel nothing, keep going, and then find a cannabis clinician to make that process faster. So
I absolutely love that. Just wanted to jump in. Just so the way we like to look at these conversations that we've been having, and now, Rebecca, I think it's been over some years, is that we always want to like be mindful of time, and we try our best to keep them brief, hour, little less than that. But it's so great, like to be in again community with you, to have the opportunity for you both, Dr. Ryan and Rebecca, to share resources and, you know, some of the experiences you've had when it comes to, you know, treating individuals with sickle cell. And something you said a second ago about the time piece, just to reiterate, because, you know, with life and just where we are, just taking the time to not be as stressed, right? Because what we know is that stress, and this is just something, you know, even from a community standpoint, we realize often when having conversations about cannabis, whether it's talking about the policy side, health, whatever the case may be, we have to take time, right? Time to really learn kind of what works best for us. And I appreciate you again so very much, both of you, for sharing the resources, right, that exist, because often it will take time to figure out what works for you. And I love the analogy you said a second ago about, you know, it's like a symphony. I wrote that down instead of using always the toolkit metaphor, because creating a symphony, I think, evokes so much more feeling and emotion when it comes to our life, right? And those who suffer with chronic pain, they aren't just patients, right? And this is something I'm actually taking a page out of A.R. Prophet's book in terms of him as an artist and a sickle cell survivor. He often says that they are dreamers, right? And it's hard to dream when you're constantly living with chronic pain. So again, to just have these conversations, to educate toward clinicians, right? And to educate also on the side of those who are living with chronic pain. It's so important. So thank you all for your work that you do. We are so appreciative of you. And certainly those of you who are still with us, if you have, again, we have maybe 3 more minutes, but if you still have a question, drop it. Don't be shy. This is a recorded session, so we will be sharing this out on our various social media platforms so it can be shared and other folks can also be a part of the learning journey that we're all on. So again, thank you all, and let's just check the chat real quick to see if there are any further questions. All right. And I don't see any as of yet. Feel free to come off mic as well if you would like. But I also want to drop before we go. Almost forgot. There is a quick little survey that you can do. Couldn't quite figure out how to put it on screen, so bear with me. But if you wouldn't mind, those of you who are on this in this conversation, who are in community with us right now, please use that link so you can just give us some real-time feedback. Again, these sessions are for the community, the general community. So we really want your feedback so we can continue to make these conversations as meaningful as possible. So thank you all so very much for being with us today.
Thank you for having us, and thanks for hosting this awesome panel. I love this conversation. So I hope the next, I'm interested when I want to hear like how AR profit. I want to hear like how's it going. So
I know, right?
yeah,
Same.
every year we'll like find that like we're doing better and better. So it's amazing how many things changed even from last year. So
Yeah, I totally agree. I cannot wait. So yeah, maybe we will make this figure out another time that works best and have another kind of round robin, conversation where we can all pull up and touch base on how things have been going with him. So I totally agree. Dr. Ryan, do you want to close us out?
Yes, pleasure to be here. I'm happy to have this conversation with everybody.
Awesome. All right, everyone, have a great week on purpose.
thanks.